Hello and welcome to It's a Code U, mental health support for those working in healthcare. This is a podcast created for healthcare employees to explore not only issues relating to mental and emotional health, but also unique challenges that those working in healthcare are faced with. Your hosts are Adina Tucker, a licensed clinical social worker with Dartmouth Health, and Jennifer Hinsey, an MSW also with Dartmouth Health. On today's episode of It's a Code U, we are going to be talking about suicide prevention. September is Suicide Prevention Month, and before we start, I'd like to give a disclaimer that if you or someone you know is struggling with mental health, experiencing suicidal thoughts, emotional distress, or a substance use crisis, help is available 24/7 through the 988 Suicide and Crisis Lifeline. You can call or text 988 to connect with a trained counselor. You're not alone. There are people ready to listen and support you without judgment. And because we are going to be talking about suicide prevention, we do have a very special guest with us today. But before I introduce her, we also have a very special co-host here today, Pam Bertolino, who is an LICSW and works with myself and Jennifer. And she has graciously agreed to fill in for Jennifer while she is out on maternity leave. So I want to say thank you to Pam for being here. And now for our special guest, we have Angie Raymond Leduc here with us today to answer all our questions about suicide prevention. Angie Raymond Leduc is the manager of the Injury Prevention Center within Population Health here at DHMC and a NAMI NH authorized Connect Suicide Prevention and Postvention trainer since 2015. She co-leads the Dartmouth Health Suicide Prevention and Response Committee and a subgroup of this committee, the Postvention Work Group. As a certified prevention specialist, Angie has expertise in evidence-based and best practice prevention messaging, education, and strategy implementation. And just to give everyone an idea of what we will be covering, we will start off asking Angie to share some of the information with us about specific Dartmouth Health initiatives surrounding suicide prevention and trainings, and then we'll transition into more general information for supporting loved ones, colleagues, and community members, as well as resources. So Angie, thank you so much for joining us, and I'll let Pam kick off the questions.
Yes, thanks. I'm so happy to be here, subbing for Jen. So Angie, hi, I just got to meet you about an hour ago in the Suicide Prevention Committee meeting. That was very impressive. Sounds like you all are working on lots of great things, but could you introduce yourself and talk about your role on that committee, just for everybody?
Yeah, thanks so much, Pam, and thanks, Adina. Thanks for having me here today. So as Adina mentioned, I'm Angie Raymond Leduc, and I manage the Injury Prevention Center, which is a part of Population Health, DHMC, and part of the Dartmouth Health system. So I've been co-leading the Dartmouth Health Suicide Prevention and Response Committee since 2019. This committee was formed out of some work that was being done under the committee, the Dartmouth Health Substance Use Mental Health Initiative, or SUMI, where it was recognized that there were lots of different suicide prevention initiatives happening in different departments throughout DHMC, and there was a need to just connect all those dots. So myself and others were assigned to find all those folks and get us together and start working together more collaboratively on suicide prevention efforts. And as Adina mentioned, I'm also a trainer in both suicide prevention and postvention. I've been training in suicide postvention since 2015 and suicide prevention since 2018.
Can you tell us a little bit about why Suicide Prevention Month is meaningful both to you and to just our hospital system overall?
Yeah. Well, what I love about any kind of prevention awareness month, and specifically suicide prevention month, is that it helps us raise awareness of different public health issues. So in this case, the opportunity to raise awareness of suicide as a public health issue and recognize different suicide prevention efforts that are underway is really important. It also reminds us that all of us have a role to play and that each one of us is capable of saving a life, no matter what our profession or role is in the community. It's in time for us to realize the more we can talk about suicide, the more likely we're able to prevent it. So Suicide Prevention Month brings to light these conversations. As a hospital system, We already know how important access to care is for our health and well-being of both individuals and communities and families. And in suicide prevention, we can take this a step further by recognizing and seeing healthcare appointments and hospitals as touch points for people at risk for suicide. And it really doesn't matter what reason people are coming into the hospital. If we have the chance at each visit to identify warning signs, recognize and assess for suicide risk, it's going to allow for more opportunities for us as a healthcare system to intervene, provide care, and save a life. And I think that we have more so than other professions that opportunity to do so because of the nature of how we provide care.
I really appreciate that last part, especially that we all play a part because it can be primary care, it could be nursing, it could be maternity ward, anything, and people can ask those questions. So I think you're really right that it could be any of us that could help prevent a suicide.
Yeah, and I think it's also any role. So if you think about someone who's helping you schedule or there might, if we all understand the warning signs and risk factors for suicide, any access point in a healthcare system, any person can take notice of something that might stand out, right? And say something and do something about it. There's a couple more reasons I think about it for our healthcare system, which is this month is an opportunity for us as a hospital to consider what our collective efforts are, which is what we try to do at the Suicide Prevention and Response Committee. So, what are those collective efforts towards suicide prevention and care? And when we as a healthcare system can implement numerous systemic prevention strategies, such as universal screening for suicide risk assessment and treatment, safety planning to include lethal means counseling, and other evidence-based practices, we really are able to significantly reduce suicide deaths in patients. So it's just an opportunity to think through what that means for us as a healthcare system. And then lastly, I think it's good for us in this month to think through all of us as healthcare professionals and that we are at higher risk than some other professional sectors. So knowing that and knowing the risk factors and warning signs can help us take care of each other.
Yeah. And so for listeners who may not be familiar, what is postvention and why is it such a vital part of suicide prevention?
So postvention, although a word that doesn't sound clear or come through is just, okay, I can figure that out just by hearing the word postvention. It's actually just a planned response, a planned comprehensive response after a suicide attempt, or any sudden death that promotes healing and reduces risk of further suicide incidents. So if done well and using best practices, postvention response becomes prevention, and that response has a few phases. So there's the acute immediate phase, which is typically what we would consider to be a crisis phase. The sudden death has taken place. And you think about it as that inner circle, those that are immediately impacted by the sudden death of a loved one, a colleague, a friend, etc. So the response would take immediate effect and surround and support that immediate circle of impact. And then those responders would be providing support and helping contain the crisis and provide resources and communication. And then the next phase is rolling into a short-term phase where that support continues for healthy grieving and healing and helping those impacted return to full functioning. And in the workplace, that would be helping them return to work or just other aspects of their life. And then there's a long-term phase where we would honor milestones while support is continued all along the way. And that's where those efforts are all turning into prevention. So that level of support, all of the safe messaging, all of the guidance all along the way and those best practices, if done well, they're turning into prevention and we're hopefully reducing risk as well as saving more lives in the meantime. It's an iterative process. So although there's best practices and guidance, when put into practice, the responders are always working to improve both prevention and postvention efforts along the whole way.
So I'm just wondering, is there a hospital-wide system that someone gets notified if there is a suicide or a sudden death? Does your team get notified? How does that work?
So our committee has a postvention work group that has been working since 2023 to develop a hospital-wide system. So we're currently in development of a best practice policy, procedures, and job aids that we hope to launch in the next couple of months that will be probably initially utilized as a resource and for immediate access for folks in the situation. And this specifically, what we're developing is postvention response in the event of a sudden death of an employee. These best practices really are transferable to other situations, but that is our scope right now. And so we're working on a number for people to call. We're developing a postvention response team and developing the resources that managers and leaders and even staff can follow in the event of a sudden death of an employee and activate a postvention response that will be a bit more comprehensive and standardized. Because as of right now, response is really different depending on where you are and what's happening. And we're working to standardize a response, but recognizing that each situation would be unique and might require different aspects of a response.
Yeah, that sounds like a huge undertaking. I'm glad that you're starting someplace.
It's been a long time coming, and we've got a lot of incredible support and many folks on the postvention work group who have expertise in different areas that are really coming together to really roll this out.
What would you say that individual staff members could do if they're concerned about a patient or even a colleague who might be at risk?
Yeah, hopefully each department or clinical team have protocols and procedures that they follow in the event of a patient or an employee demonstrating suicidal risk. So certainly check in with your leadership. And if not, it's really important that first you remember you're not alone as a person who may be concerned. And so therefore you should be concerned alone. So I would let a supervisor or a colleague know about your concern before letting that patient or that colleague leave, if at all possible. We certainly want to make sure that, especially if it's immediate risk, that risk has been assessed. And so you want to connect with that patient or colleague directly, let them know your concerns and that you'd like to help them get connected to help, and then connect them to that appropriate help, excuse me. I recommend people being trained. I can help connect people to suicide prevention training if anyone would like that. It can feel sometimes like a daunting task, or maybe it feels like my role. I don't need that in my role. I think if people were to take the Connect Suicide Prevention training, they would see that everyone has a role to play, and there are some really simple strategies to connect with someone at risk and connect that person at risk to help.
Yeah, it seems like it would be a good idea to have someone in every department trained in that area.
I would love that, Pam. And it is a goal. We're trying to expand through the committee as many training opportunities as possible. And right now, suicide prevention training is not mandatory for most roles. And I'm not sure actually if it's mandatory for any roles. And we would love to see a broader training process take place for all staff.
Well, we'll try and help advocate any way we can.
No, that makes sense because definitely I know obviously we're therapists, so we see employees, and I know that I've had several that have been impacted by the suicide of a colleague. So I think it's important because patients and colleagues are at risk, but healthcare workers in particular are there's a lot of trauma and stress that can come with working in healthcare. So having someone who's trained in every department seems like that would be like definitely something we'd want to strive for.
Yeah, we would love to see all staff trained in suicide prevention. And certainly we also have postvention trainers. So we would love to see roles in departments that would be providing support and response to be trained in postvention. So postvention is not something that necessarily everyone needs to be trained in, but certainly anyone who would be providing support and response in the event of a sudden death should be trained in postvention.
What's something you wish more healthcare workers understood about suicide prevention and postvention?
That is such a great question. I think what I've heard is quite often people think that's not my role. And so I think it would be great if healthcare workers understood that it takes all of us, it is all of us, no matter what our role, and we're all responsible for helping prevent suicide. So to be able to see that I can make a difference, I could recognize warning signs and risk factors, and I could connect someone to help. And it doesn't really matter what my role is. It's just being another human being who sees somebody struggling and connecting them to help. It's similar to the campaign, if you see something, say something. That's how I think of it. It's very similar to that. So suicide prevention is like that too. So in healthcare, because we want to save lives, we're here to help improve people's health and well-being. And so to me, that includes the need to recognize suicide risk and connecting people to the appropriate help, and that all of us are responsible for this, no matter our role. And as I mentioned with the training, anyone can learn the risk factors and warning signs. We can recognize them in others. We don't need to have a clinical degree for that or that experience. And if we're equipped through understanding that knowledge, then we'll know how to connect with a person at risk. Sometimes it's just asking, are you okay? Can I help you? And then we can connect them to help. So really knowing what those warning signs and risk factors are, really just making that human connection of, I'm sorry you're struggling, how can I help you? And then just really knowing the resources to be able to connect them to help, and that you're not alone. And so these trainings are available. And within those trainings, there's simple steps that can be taken to help someone get the help they need. So no matter how scary it feels, you should always connect with others. Don't do this alone. If you're in a situation you're unsure of, and then just know that if you connect with others, you're not alone, and then you know the information, it's going to be okay. It's easier than you think it is.
Well, and I think it would help people in their personal lives too, because we're all touched by death by suicide in some way. So just to have some resources or some understanding if it comes up, whether it be your children's school or whatever area it is, I think people would feel better if they knew something or had some kind of knowledge.
Yeah. I'm contacted a lot, especially when there's been a sudden death in the community. And I'm typically contacted by my colleagues who just know about the work that I do and they want help and resources for their own communities. So, yeah, you're exactly right. We're all impacted by suicide death and sudden death in general. And it's good to equip ourselves with the knowledge to be able to help. Postvention being a comprehensive and planned response, it prepares us to take action and to take care of those that are most impacted by suicide or sudden death, and our teams and our communities. It's good for us to know that it helps to contain the crisis. Sometimes in a sudden death, it feels it's overwhelming, right? And there's a lot of uncertainty and we're not sure what to do. So having an effective postvention response helps contain that crisis, and it really sheds light on all of the resources and support that do exist. And it makes that direct connection of those supports. And then we're working together effectively in the hopes to prevent future suicide deaths, as well as work together for healthy grieving and promoting healing. And what I love about postvention response as well, if done effectively, it brings us closer together as a community, allows us to just build connections, share in our concerns, and we're looking out for one another. And we're talking about something that's really hard. Death and dying is really hard. And this is a way for us to be together in that and take care of one another through that process.
What myths or misconceptions about suicide do you think are the most important for us to challenge during Suicide Prevention Month?
Stigma really is very strong still around surrounding suicide. So I feel like we've come a long way in the last 10 years, and yet it still gets in the way of us talking about suicide and collaborating on suicide prevention efforts, or even wanting to learn more individually about it. Some of that stigma might look like people being concerned that if we talk about suicide, we might give someone the idea to attempt suicide, when in fact studies have shown, especially after 30 years of crisis hotlines, that talking about suicide actually helps to reduce suicide risk. Stigma can also look like someone thinking that this issue has nothing to do with them. Going back to, it's not my role, and so I don't need to participate in a conversation or learn anything about it. And yet suicide and suicide risk affects all of us. And as I've mentioned several times, we all have a role to play in helping reduce suicide risk. But one of the toughest barriers I've seen and heard is that the responsibility of knowing about somebody's suicide risk is really heavy, right? And that can be true. It is a heavy thing and it feels really like a huge responsibility. and then you might feel like you don't know what to do with that information, and it's scary. So it's easier to drop the subject or walk away or hope somebody else will handle it. But there, even though those may be true, those feelings may be true, just know that you don't want to drop it, right? You want to pass it on to someone else, at least make sure that someone else knows about your concerns, about what you're aware of, and that you can connect with someone else and make sure that person is connected to help. Even if you're not the one who can provide the help, you can connect that person to somebody else who's willing and able to help. So there's something all of us can do to help. And so I hope that barrier can be busted this September, right? We can all do something to help. There's something within reach for all of us. And it's just connecting to that person at risk, connecting them to help, and recognizing you're not alone. You don't have to help anyone alone. So let others know and help get that person the help that they need.
So I have a follow-up question now. Something you said made me think of something that people have mentioned. And when you're talking about the stigma around suicide and, you know, how I was just thinking about how some healthcare workers who are in crisis or feel like they might be at a danger to themselves are actually reluctant to go to the emergency room because maybe they work in that hospital. And I've heard that a few times, and so I'm just wondering if you have any thoughts or words of support around that.
Yeah. I do think that our suicide prevention trainings can help reduce some of that stigma, help create a culture of caring for each other and caring for our colleagues. I do think healthcare workers have that extra stigma of being, I'm the helper, I'm the care provider, worried about what others are going to think if they need help. And so we have a lot of work to do, I think, in helping reduce the stigma around that. And hopefully, with training, with more awareness campaigns, with more understanding, we're creating a culture in our organization where, and it's true, it's okay to get help. You're feeling what you're feeling, and it's okay to share your feelings, and you should safely do. I hope we can get there, because I agree. I've heard similar things where healthcare providers are hesitant to seek help because of that stigma.
What resources are available within the hospital system for staff who are struggling? I mean, besides the emergency department?
Yeah, I was just going to say, for someone at immediate risk, right, and immediate high risk for suicide, you want to either call or text 988 or go to the emergency department. But for others who are struggling, but suicide risk is low, we do have compassionate and experienced and supportive counselors in employee assistance program and KGA employee assistance for non-DHMC locations. And KGA also provides 24/7 access to professional counselors. And those counselors will connect employees with the appropriate specialists and resources. We also have the Dartmouth Health Behavioral Health Solutions team and Cobalt, spiritual health, and definitely some other role specific resources, such as the Behavioral Medicine Clinic for GME residents and fellows. And the employee wellness teams have put together a document that provides all the supports for our system. So I'd love to be able to share that with this podcast if we could. It gives a more detailed list of all of the different resources available to employees.
Yeah, no, we can for sure put that in the show notes for anybody that wants to take a look at it. For anyone who's listening who wants to get involved or learn more, what next steps would you recommend to them?
Yeah. Please reach out to me so we can get connected. I'd love to share what our different committees are up to, what we're working on. Would love to invite you to the meetings if you're able to attend. And if you're interested in getting suicide prevention training, can help connect you to that as well.
Are there signs that someone should look for in a loved one who might be struggling and not know how to ask for help?
Yeah, well, I'd love to be able to share this warning signs poster that both provides the warning signs and how to connect to someone at risk. But warning signs that you might see are talking about or threatening to hurt or kill oneself, seeking firearms, drugs, or other lethal means for killing oneself. And that could even be seeing somebody research that on the internet, writing about it, talking or writing about death, dying, or suicide. You might hear some direct statements or less direct statements of suicidal intent. So some of those examples might be, I'm just going to end it all, or everything would be easier if I wasn't around. So one is direct, right? And one is less direct. Feelings of hopelessness, feelings of rage or uncontrollable anger, feeling trapped, like there's no way out. I think one thing to really look for are dramatic mood changes. So somebody might be withdrawn or seeming down for a long period of time and then suddenly happy and content, or the opposite, right? They've been in a good space in their mood and then all of a sudden withdrawn and sad. Acting reckless or engaging in risky activities, increasing substance use, withdrawing from friends or family. For younger people, changes in their attendance in school, and for working adults, changes in their performance or attendance at work. Feeling anxious or agitated and being unable to sleep or sleeping all the time. Those are some of the most common warning signs. And I'm happy to share the poster with that. And if you're seeing these, then, ask directly about suicidal feelings, because as I mentioned before, talking about suicide is the first step into preventing it and it helps reduce risk. So let them know you care. Keep them away from anything that may cause harm, such as firearms, pills, medications, ropes, knives, or vehicles. Stay with that person. Don't leave them. Keep your eyes on them all the time, and definitely get a professional involved. Always offer messages of hope. Let them know you're going to assist them in getting help and then connect them with help.
That kind of rolls right into the next question, which is for anyone who might be struggling, what would you want to say to them? You started to answer that, I think.
Yeah, so I'm sorry that you're not feeling well. Please know you're not alone and help is available. It's okay to share how you're feeling. It's good to talk about it. Talking about it can reduce your distress. And please consider reaching out to someone that you trust and together get connected with the resources that can help. And we'll share some of those resources today.
Well, so one thing I was thinking while you were talking, some things you were saying about reducing the stigma, just like having more conversations about it. And I feel like that is such an important piece of it. I mean, not just for suicide prevention, but for lots of things, right? Is like that feeling of I am alone. No one understands how I feel. That can be so isolating and make things so much worse. And I even think about things like women experiencing miscarriage. That's something that's nobody talks about that. And that can be a very isolating thing. So I think promoting more conversation and educating people about how they can play a role in prevention, but also just that conversation of it so that when someone does experience something that is, or they're struggling, there's maybe we can start to eradicate some of those feelings of isolation and more people will then be prompted to share their own struggles or even say, "Hey, I know exactly how you're feeling, like like it's okay."
Said, that's exactly it. And I think it goes back to the best way for us to change the culture, right, around suicide prevention is to keep talking about it and create more opportunities to do. It is one of the reasons why Suicide Prevention Awareness Month is so great because it forces us to be like, oh yeah, we got to talk about this, but we should be talking about it all the time. And the committee, we do talk about it every other month in the committee. We talk about that on the Postvention work group too. So there is a platform for ongoing discussion within the Dartmouth Health system. So if people that's okay, want to be more involved, certainly, and have more of those conversations and help work towards collectively, how can we work towards reducing that stigma, creating a culture of being okay to talk about it, helping connect others so they don't feel alone. There's some really great work that's happening, and the committee is one way to get in the know of that and keep that conversation going.
Well, it's been really really great and really informative because a lot of these things I didn't know about. Are there any like anyone listening who I guess is struggling or just wants to be more educated? Do you have any final words that you would want to say to them?
Yeah, definitely. Please take a training. There are different types of trainings. There's a community helper training that's for anyone age 18 and over. There are also some specialized suicide prevention trainings targeting specific sectors like healthcare professionals, mental health care professionals, school personnel, social services, and more. People can get the same information as a community helper training, but then expand into their professional sector to learn more how that particular role can address suicide prevention. And definitely reach out to me. I can share what I know and connect folks to others who are doing great work as well.
This has been really great, and I think this is going to be really great for our listeners and the other DH employees. I really appreciate you being here.
I'm so grateful you created this opportunity. We can help get the word out, and just thankful for all the work you guys are doing and creating these opportunities to raise awareness. So thank you for that.
And thank you, Pam, for being here with me on this journey. Again, we'd like to thank Angie for joining us and Pam for serving as my co-host. We'd also just like to remind anyone listening as well that if you or someone you know is struggling with mental health, experiencing suicidal thoughts, emotional distress, or a substance use crisis, help is available 24/7 through the 988 Suicide and Crisis Lifeline, and you can call or text 988 to connect with a trained counselor. And just remember that you're not alone, and there are people ready to listen and support you without judgment. We'll also have all of the resources linked on our show notes for anyone who is interested in those. If you have any questions, comments, or feedback, please reach out to us at dhbhs.media@hitchcock.org, and we appreciate you listening.